Let's now proceed to treatment principles, treating both root and manifestation. This approach is widely used in practice. In chronic cases, when the clinical manifestations are severe and distressing for the patient, it is necessary to treat both the root and the manifestation simultaneously. This approach is also applied when the clinical manifestations themselves are such that they would perpetuate the original problem. For example, in the case of a woman with Qi deficiency leading to excessive menstrual bleeding, Qi not holding blood, prolonged menstrual bleeding over many years will in itself lead to further deficiency of both blood and Qi. If the spleen-yang deficiency is causing very severe and debilitating diarrhea, particularly in an elderly patient, it would be necessary to treat the root, that is, tonify and warm the spleen. But at the same time, also take active steps to treat the manifestation, that is, stop the diarrhea. In acupuncture terms, this would involve using points which are known to stop diarrhea, whatever the cause, such as stomach 25 and stomach 37. By contrast, if the diarrhea was not so severe and the patient not old, it would be sufficient to simply treat the chronic deficiency of spleen-yang. In the case of a patient suffering from spleen-yang deficiency causing severe edema, the correct approach would again be to treat both the root, that is, tonify and warm the spleen, and the manifestation, that is, eliminate the edema. In acupuncture terms, this would involve combining the reinforcing method to tonify the spleen with the reducing method by reducing points to move fluids such as Ren9, stomach 28, and bladder 22. In the case of a child who has severe whooping cough caused by phlegm heat in the lungs, it would be necessary again to adopt the method of treating both the root by clearing lung heat and resolving phlegm, and the manifestation by stopping the cough. This is the correct approach since the cough is very distressing and debilitating to the child. So it would be wrong to simply treat the root and wait for the symptoms to improve. This example can be compared and contrasted with the case of a chronic slight dry cough caused by yin deficiency, in which case the cough is not bad or serious enough to warrant treating the manifestation. In the case of original and deriving patterns, treating both the root and the manifestation simultaneously is a strategy that is applied very often and is indeed the most common strategy. For example, if spleen Qi deficiency, the root, gives rise to dampness, the manifestation, one usually tonifies spleen Qi and resolves dampness simultaneously. However, please note that when we treat both the root and the manifestation with herbal medicine, it is not a case of giving 50% of herbs for the root and 50% for the manifestation. We still need to make a conscious choice between a formula that treats the root, for example, tonify the spleen, and one that treats the manifestation, for example, resolve dampness. With acupuncture, the approach is different because acupuncture works in a different way. Acupuncture points have a broader and more neutral action. The same acupuncture point may tonify the spleen and resolve dampness, and Ren12 would be a good example of this. Treating the root and the manifestation simultaneously is a strategy that is applied very often whenever the manifestation produces severe symptoms and signs. Thank you for your attention.